Our first One Health committee meeting. This is a platform that brings us together, the people from the human health, also from animal health, but also from the environment and the crop and water. So bring the different sectors together to be able to respond to public health issues that come from those different sectors. We put together our minds and are able to respond together. And we know that Kabale district, even as a nation, we are responding to monkeypox. In our region, we're having anthrax. We also now have a threat of Marburg virus disease from across the border. And One Health, ideally, is to respond to these zoonotic diseases. These are conditions which initially were for animals, but they are spilling over to the human population. So it gives us a platform where we meet together and we're able to collaborate our efforts and respond together such that we have a very effective and coordinated response to these public health issues. So this morning, as Kabale district, we're having this meeting, and in the meeting, we're putting together a One Health response plan to these conditions or the threats that we are facing: anthrax, monkeypox, and also Marburg virus disease that is just across the country. So we're together putting this plan in place such that we see the roles of each different sectors in this response. And the meeting was very fruitful because we were able to put together a plan, and now we know how to move coordinated, how to synergize and optimize our different strengths from the different sectors, how we can easily penetrate the communities and have coordinated surveillance both from the animal, human and other sectors such that we are not left behind. We were able to have the RDC, and so we were able to engage security to support us where need be in investigating, but also in enforcing some of the agreed strategies.
So far now?
Yeah, every plan has to have a budget. We have a budget there, but actually, among other things, we are looking at the strategies that we can use to be able to finance the plan, because it's a budget, but financing, we have to engage different partners and see how to be able to put in place or implement the activities that we want to do to have an effective response. So we are still sharing the plans with our partners to see what they can support in the different activities. As a district, we're also facing rabies. Actually, in that case, we are responding to rabies in in several sub-counties where I've had rabid dogs biting people. And unfortunately, the communities are not cooperative as we would expect. They are going ahead to consume some livestock that has been bitten by rabid dogs. So we have agreed on how to go about those local issues to make sure that even the rabies case is under control. We last week were able to, together with the vet team, to do vaccination of the animals and also give post-exposure prophylaxis for the individuals who had had exposure to rabies. We are responsible for operating Katuna border point, and we are tasked to make sure that we do not import Marburg virus disease from Rwanda. And so at the border already we have heightened surveillance, but also screening. We have always screened, but now we have made it more compulsory, I think, than before, that every traveler coming in, they're having to go through the screening point, and they're all screened, especially for the fever. But also we have prepared the border point. Should there be need to hold anyone, there is a tent, but also a facility that has always been there now is prepared to be able to retain and investigate until they are able to be evacuated. So the border point is actively screening. Of course, unfortunately, we have several porous border points, and this we are working together with security and also community awareness to be alert and be careful to interact so much with the people across the border that have not been screened. But at the gazetted border point, we are doing active fever screening, but also active surveillance at the border point.